We spend so much time and energy on what happens inside our clinics. The scheduling, the technology, the staffing. But what if the real bottleneck, the thing that's quietly putting a cap on your practice's potential, is a daily struggle that happens miles away, long after your patient has left the chair?
You know exactly what I'm talking about, don't you? That nightly showdown over the toothbrush, the negotiations, the tears, the sheer exhaustion. For parents, it's a massive headache, but for your practice, it's actually a huge clinical and financial problem. We're talking avoidable cavities, wasted chair time on rework, and a reactive drill and fill model that, let's be honest, nobody really loves.
And look, the data absolutely confirms this. When you break down the pediatric engagement gap, poor at-home compliance isn't just a problem, it's nearly half the entire problem. It's the big, leaky hole in the bucket. Almost every other issue, from kids being afraid of the dentist to families missing appointments, flows right from this fundamental breakdown in daily habits.
So, to really get a handle on the financial hit this is causing, we need to zoom in on one critical metric: patient lifetime value, or LTV. This isn't about the revenue from a single cleaning or a filling. No, this is the big picture. The total revenue a patient, and just as importantly, their family and their referrals, bring to your practice over years, sometimes even decades. Honestly, this number is the true bedrock of a healthy, sustainable practice.
So what's a patient actually worth? Well, when you factor in their own treatments over about a decade, plus the couple of referrals they're probably going to make, that one single hygiene patient represents a $9,000 asset to your practice. Suddenly, the idea of losing that family because of the nightly brushing battle, well, it starts to look terrifyingly expensive.
Okay, so we've laid out the problem, and we've seen the stakes are incredibly high. So how do we actually fix this? The answer isn't another lecture or a new pamphlet. The answer is actually a proven strategy that's grounded in real behavioral science. Let's dive into it.
The strategy is called gamification. And look, before you think this is just about letting kids play games on a phone, it's not. This is serious science. At its core, it's about taking the things that make games so compelling, points, rewards, challenges, a sense of progress, and applying them to everyday tasks. The goal? To tap into our brain's natural desire for achievement and make healthy habits feel less like a chore and more like, well, fun.
And the research here is absolutely rock solid. Study after study, systematic reviews, they all point to the same thing. Gamification is a powerhouse for boosting motivation, commitment, and adherence to healthy behaviors. In simple terms, it transforms something that parents have to nag their kids about into a daily win that kids actually start looking forward to.
All right, that all sounds great in theory, but what does it actually look like in the real world? Let's take a look at a real-world application of this science, a tool that's completely flipping this whole dynamic on its head. So, take an app like EarnX. The process is just brilliantly simple. The child gets to pick a real-world reward they genuinely want. We're talking things like Roblox credits or Amazon gift cards, stuff they're already asking for. Then they earn points for doing their daily brushing and flossing. Once they hit their goal, they get the prize. It's a perfect closed loop of effort and reward that just works. And this, right here, is where the real magic happens. Remember, in pediatric dentistry, the parent is your #1 client. So when you solve their single biggest daily struggle, when you end the brushing battle for them, you're no longer just their dentist. You become a partner, a hero even. And that generates a level of fierce loyalty and word-of-mouth marketing that you just can't buy with a billboard. Okay, so it's fun for the kids, it's a huge relief for the parents, but does it actually move the needle where it counts, in the clinic? And what does this all mean for your bottom line? Let's get into the numbers.
This is where things get really powerful. Clinical data shows that practices using these kinds of interactive tools are seeing on average a 63.4% drop in plaque scores. I mean, stop and think about that. That's a massive measurable leap in at-home compliance.
And it doesn't stop there. That same data shows a nearly 59% reduction in gingival scores. These aren't just fuzzy, feel-good numbers. This is concrete, clinical proof of better health outcomes, and it's being driven directly by better engagement at home.
This table just lays out the whole strategic shift perfectly. You're moving from a reactive, inconsistent home care model to one that's proactive and automated. Your valuable chair time shifts from fixing the same avoidable problems over and over to performing higher-value procedures. Your relationship with parents goes from enforcer to partner. And this last one is the big one for owners and CEOs. Your practice evolves from being just a service business into a truly scalable, valuable community asset. This chart just paints the picture so clearly. That first bar, that's your standard patient LTV. Now you introduce a gamified tool, retention goes up, and that LTV immediately gets a boost. That's the second bar. But here's where it really takes off. You add in the word-of-mouth referrals from all those happy, loyal families, and you get that beautiful, exponential growth you see in the third bar. That's the dream, right there.
We've seen the incredible impact on individual patients and their families. So now, let's zoom all the way out and look at the biggest picture of all. What does this strategy mean for the fundamental value of your entire practice as an asset?
If you take away just one single thing from our chat today, please let it be this. Dental gamification is not a fluffy marketing gimmick. It's a core clinical strategy that, for maybe the first time, perfectly aligns what's best for your patients with what's best for your business. With this approach, better health outcomes become the engine of your profitability. Your commitment to great care becomes your most powerful driver of growth.
Ultimately, this choice changes the very nature of what you're building. A practice that's stuck just reacting to problems is a service business, and there's a natural ceiling on its value. But a practice that proactively builds an ecosystem of wellness around its community, well, that becomes a scalable asset. And that kind of business carries a significantly higher valuation, whether you're looking to expand your group or planning your eventual exit strategy.
So the question I'll leave you with is this. What kind of practice are you really trying to build? Is it one that just reacts to problems as they show up? Or are you building one that proactively creates a future filled with a lifetime of health for your patients, fierce loyalty from their families, and true exponential growth for your business? The choice is yours.